Good morning, everyone. I'm Commander Antoinette Percy-Laurry, and I am representing the team from the National Cancer Institute. Our project is Evidence-Based Intervention Implementation Accelerator, helping behavioral researchers get their programs into practice to have an impact on public health. Look, this cartoon gets it. The latest research shows that we really should be doing something with all this research. Example, the government invests billions in scientific discoveries, and the public hasn't seen a good return on their investment. So this leads me to my story about Dr. Ida Smith, a behavioral scientist. Now, Ida received a grant to develop an intervention to reduce obesity in children. And Ida's intervention was a program that taught inner city parents and children how to eat healthy and to make exercise fun for kids. Her intervention proved successful, and because she saw significant weight loss, and she wanted to share her intervention into other cities. However, Ida was at a loss of how to market her program, how to connect with small businesses, or even how to distribute her program to organizations like the YMCA. Well, Ida is not alone. Many researchers would like to get their interventions into common practice, but they lack the skill set or the entrepreneurship. There are hundreds of successful interventions out there. You have your cancer screening, your vaccination uptake, tobacco control. But as research by Ballas and Boren shows, it takes 17 years just to get 14% of research into common practice. So the problem is researchers have health interventions that work but are not widely used. So the public is not benefiting from these successful interventions. So we at NCI interviewed 34 researchers and found that they don't have a plan or a process for implementation. And many struggle with not knowing how to market their programs. They just lack the skill set. So our solution is the Dissemination and Implementation Accelerator program, a curriculum designed to help researchers create business plans that move their research interventions into widespread use. And we would measure how the Accelerator program is working over time by looking at the number of good business plans that the participants would create. We sent emails about our Accelerator program idea to 320 researchers, and of those who responded, 80% were ready to apply. Now, the National Science Foundation Innovative Corps and Ignite, HHS Ignite, are doing similar projects, but they're not specifically focused on behavioral scientists. So in summary, to define and understand the problem, we conducted 47 interviews. To refine the problem we identified, we had 3 second interviews. And to assess the interest in our Accelerator idea, we sent 320 emails to researchers. Now, from the initial interviews that we did, 34 were researchers and 13 were other stakeholders. So we identified from those interviews that the researchers who would benefit most from our Accelerator program, and those we call our hungry investigators or hungry researchers. They're typically younger or new grantees excited about dissemination and implementation. So in conclusion, the Accelerator program could address issues in the current process for getting successful interventions into the real world. Also, researchers acknowledge that they are not entrepreneurs and that they need assistance in collaborating with businesses. What's next for us is that we will work with Innovative Corps to model their curriculum that prepares scientists for entrepreneurship, and we would secure funding from our NCI division and conduct our pilot next summer. So this is our team. I would like to, special thanks to Cindy Vincent, who is our team leader, and also to David Chambers, who is our sponsor. He's the Deputy Director for Implementation Science at NCI. And also thanks to Ignite for this opportunity. Thank you.